It's a time of the season now where we're getting into football and other activities in which things like concussions occur. The question becomes what is a concussion and how do you treat it? A concussion essentially is a trauma to the brain. You don't have to be knocked out to do that, but instead it's just that brain gets rattled around inside your skull and it creates some damage to the brain. A concussion can be having many different types of symptoms, everything from headaches, memory loss, even personality and mood changes. It may not be noticeable to the person who has a concussion, but a family member may say that they're acting a little bit different. Once you've had the concussion, you have to rule out any type of trauma. There may be a brain bleed, things of that nature, and a trip to the ER may be necessary. Upon coming to the office, you're going to have a full examination. The examination consists of a thorough history of what happened at the time of the concussion, what happened after the concussion, any symptoms, as well as what you're feeling like right now and then. Symptoms may change and evolve. Once we've done that complete history, we do a thorough, complete examination of the head and neck area, including all the muscles. We look at testing called SCAT testing. SCAT testing essentially looks at things such as balance and memory and allows us to objectify or put a number to what the deficit you're having is. The treatment protocol is going to vary from person to person, and those treatment protocols are going to involve resting and not letting the brain be stimulated again. If you have a sprained ankle, you wouldn't walk on it to get better, and the brain works the same way. The treatment protocol is not that difficult, but can affect many things, especially when we're talking about student athletes. Now, you don't have to be at school or have a sport to have an athletic injury. You can have a concussion from a fall or a trip at home. And for that reason, a concussion is not something that you want to just not worry about. If properly treated, it can help you become better faster, as well as not have any long-term problems or what we call deficits. So for that reason, if you have the suspicion that you're having a concussion or had one, by all means, give us a call. Let us do an evaluation and find out what is the best treatment for you to get you better.